you a question about that investment in research, which you deeply care about and have fought so hard for many, many years. Some people say to me, why should we fund research? Isn't that going to continue to increase our cost? What would you say to that?
Well, if there's a cost in prolonging lives, money well spent. One of the things that I have been very much concerned about has been the reduction in the funding for the National Institutes of Health. That is a subject of particular interest to me, concern. I spent a good bit of my 30 years in the Senate working on the subject. I came to the Senate after the 1980 election. The budget for NIH was a little over $3 billion. When I became chairman, it was about 12, and we more than doubled it. Now the funding for NIH this year will be more than $300 million less than last year. And we will lose a generation of scientists. We will lose an opportunity to make very important advances in biomedical research unless that is changed. And right now, with the Tea Party in a dominant position, it looks doubtful that it will be changed unless the electorate raises hell. There's enormous political power among the universities. Penn, for example, and Pitt each have gotten $4 billion in the last decade. They have powerful boards of directors. This is replicated across the country. Vanderbilt and Johns Hopkins and you name it. And if they were mobilized and organized and put some political pressure on, it could be a different picture. But the current attitude is inertia. And I think the prospects for adequate funding for NIH at the moment are somewhere between bleak and black.
And in a way, we have no one to blame but ourselves. We don't get involved. Leaving it to who is involved means leaving it to a fringe that doesn't assign much priority there.
That's right, Arthur. If I was a little differently disposed driver, I would put a bumper sticker on my car. The bumper sticker would read, "Don't blame me, I ran for president."